What I want to talk about today is one of the basic minerals. We talk about 60 essential minerals, but one of the basic ones is calcium, of course. There's actually 147 different diseases you can get from a calcium deficiency. 147 different diseases. They're all kind of disparate. They're all over the screen, and so people don't relate them together as being calcium deficiency. Periodontal disease, which is osteoporosis of the face, you're losing your teeth. Kidney stones, which have to do with your parathyroid glands not being happy because they don't have enough calcium floating around, so they pull it out of your bones, and you get kidney stones as a result of being calcium deficient. Doctors would tell you get kidney stones because you have too much calcium. It's just 180 degrees the other direction. And then osteopenia, osteoporosis, osteoarthritis, degenerative arthritis, bone-to-bone arthritis, rheumatoid arthritis, which has a infection piece to it, mycoplasma, a bug that's killable in 2 weeks with antibiotics. Then there's bleeding problems because calcium is required for the blood clotting mechanism, blood pressure, headaches, degenerative disc disease, things like bone spurs, peripheral neuropathies. All this stuff are just some of the very few things that you get from a calcium deficiency. A lot of your enzymes won't work without calcium cofactors and so on. So that's how important calcium is. Well, the thing I want you to appreciate, doctors of all specialties love calcium deficiency. Dentists love it because you get periodontal disease. Urologists love it because you get kidney stones. Neurologists love it because you get peripheral neuropathies and headaches. Hematologists love it because you get blood clotting problems. Orthopedic surgeons love it because you get bone and joint problems. You're beginning to get the picture here. Everybody loves. Podiatrists love it because you get bone spurs in your heels. Everybody loves a calcium deficiency. It is the most common nutritional deficiency when it comes to minerals is a calcium deficiency. Well, in 2002, July of 2002, Harvard Medical School, the actual orthopedic department of Harvard Medical School, orthopedic surgeries, they actually did a study on 300,000 charts from around the world where people had joint replacements. They published it in the New England Journal of Medicine, said joint surgery, knee surgery, hip surgery for people with arthritis is worthless. And that's because the rest of your joints continue to get bad. And what I like to use instead of surgery is the Healthy Bone and Joint Pack. It has all 90 essential nutrients in optimal amounts, including the secret sauce that's designed to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, matrix, bone itself. People say, "No, wait a minute, Wallach, my orthopedic surgeon says," I love that, "my orthopedic surgeon says you cannot regrow cartilage." Well, Frankie, your orthopedic surgeon is a liar. He's an absolute liar. I don't know how to say that any more kindly. Because if it was anything but a liar, he'd be a crook, because he's using you as an ATM machine, because you can, in fact, rebuild cartilage by supporting and promoting maintenance and repair. We've been doing this for 36 years. Started out as Dr. Wallach's pig arthritis farm, and we blended it over to what we call now the Healthy Bone and Joint Pack. It has all the nutrients in there to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, matrix, bone itself. Then 4 years later, November of 2006, the same group of orthopedic surgeons looked at the backs on these charts of 300,000 people, published in the Journal of the American Medical Association. They said, don't do surgery for back problems. Surgery is too dangerous, right? They said, you don't need surgery for back problems. Sciatica, peripheral neuropathies, burning, numbness, pain in the feet and legs, tingling in the legs and arms and hands, disc problems, bulging disc, low back pain. You don't need it. You don't need surgery. Do not do it. It's unsafe. It's safer to do nothing. I mean, this was the Journal of the American Medical Association, November 2006, because they kept looking at these 300,000 people who had joint replacements, had back surgeries, and they are falling apart, okay? And so, again, I want you to get a hold of the trilogy of books would be the best place to go here. The trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and Passport and Aromatherapy, and learn how to deal with 900 different diseases, including all these 147 different calcium deficiency diseases, okay, using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. That's your trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Now, how many vitamins does calcium need to work as a cofactor? Well, vitamin A, vitamin D3, vitamin C, those three in particular are required. You can't absorb calcium without vitamin D3. You can't put it in your bones without vitamin D3. You can't make bone matrix without vitamin C. You get scurvy if you don't have enough vitamin C and your bones fall apart. For growth of bones, you need vitamin A, right? You need all 90 essential nutrients. You need the 90 essential nutrients. I'd get the Healthy Bone and Joint Pack, 1 per 100 pounds of body weight. You give your body what it needs, and it will support and promote maintenance repair. This is not difficult. I get so excited about this. I've been foaming at the mouth about this for 36 years for humans. I've been foaming at the mouth about 36 years now. I played sports in high school. I lettered in high school in football. I only weighed 123 pounds. I lettered in football as a middle linebacker and a pulling guard on offense. I lettered in wrestling. I lettered in wrestling at the University of Missouri. And I never got injured once in 8 years of high contact impact sports. Never got injured once, and I was like half the size of everybody else in football. Wrestling, I did wrestle against people my own weight class, but when it came to football, I was playing football against people who were double and triple my size. Okay? They were the ones that got injured because I was taking all 90 essential nutrients. Well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, this would, I would say this pretty well vindicates you. As in, once again, this is what you've been talking about for some time now. This comes from Fox News. The headline of the story reads, 1/3 of knee replacements in the U.S. may be inappropriate. They say 1/3 of knee replacement surgeries may be inappropriate, according to a new study. The lead author, Dr. Daniel L. Riddle from the Virginia Commonwealth University in Richmond, says that we found that some patients undergo total knee replacement when they have very low-grade symptoms or minor knee arthritis. Number of total knee replacement surgeries done each year more than doubled between 1991 and 2010, leading some to question whether the procedure is overused. And they say it is hard to prove since pain tends to drive the decision to proceed to the surgery, and different people perceive pain differently. And he said to get the idea what's going on, Riddle and his team analyzed data from a study of about 4,800 people in the U.S. with knee osteoarthritis or high risk of the condition. During the study period, 205 of them, a total of, had total knee replacement surgery. And the researchers used criteria for knee replacement developed by Dr. Antonio Escobar of the Hospital de Basurto in Spain. The surgeries were judged to be appropriate, inappropriate, or inconclusive, considering factors like a person's range of motion, pain, and arthritis severity. Based on prior studies, researchers expected to find about 20% of the surgeries being inappropriate, but what they did find was 34% of the patients that had total knee replacements were deemed to be inappropriate. Patients had symptoms that were moderate at worst and joint damage that was not widespread. Yeah, they say less than half of the knee replacements, 44%, were classified as appropriate, and 22% were inconclusive. This was all published in the journal Arthritis and Rheumatology. But this is something you've been talking about for a number of years. And wasn't there a Harvard study that came out that said that knee replacement for knee pain was worthless? Well, yeah, that's what I did in my monologue today, of course. When I mentioned that, you may have been busy with paperwork while that was going on, but actually I mentioned that study. And one of the things they didn't do, which they should have done, when they take these people's knees out, they should have physically eyeballed those knees and so forth, which would have been really great. They never do that. They just cut the knee out and throw it in the garbage can because they've got x-rays and they think they know everything they need to know. What they should have done was actually open up those knees and look at them, because they just cut them off above the knee, cut them off below the knee, install the device, and go on to the next surgery. And nobody looks at those knees. Well, I used to do that. And so I knew it was a problem there. And so the first formula that I made for humans, Doug, it was a commercial formula, was Dr. Wallach's pig arthritis formula. You may remember that. I do. Yeah, the pig arthritis formula. Still, we sell a lot of it today. People love it. It's still good today as it was then. And, of course, it only contained 4 products in it back then, but it had all 90 essential nutrients and optimal amounts. It was revolutionary, and it's still beloved. And I'll tell you, we sell a lot of the pig arthritis formula. You can get it for wholesale, and it's a joy to see how many people are using this now. And they're opting out of the surgeries because they're having to pay the deductibles now. When insurance is paying everything, the deductibles are $50. They say, okay, doc, you say that knee surgery is what I need. They wouldn't even get a second opinion. They would just jump in and let the doctor take their knees out and put the device in. Well, as you say, 1/3 of them, 3 out of 10,
Okay, 3.5 in this case, almost 4 out of 10 were inappropriate. And, of course, with the right raw materials and the pig arthritis formula and the healthy bone and joint pack, we can support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae, bone makes the bone itself. Do not get the surgery, folks, to give us 90 days. Thank you, Doug. Super job. And we'll be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's go to callers.
Let's head to Milwaukee, Wisconsin. And Denise, you're on with Dr. Wallach.
Hello, Denise, Wallach. You're on the air. Hi, how can I help you?
Dr. Wallach, I have a brother in Detroit, Michigan. He's 50 years old, and he was recently diagnosed with brain tumors. I don't know what stage they were, but just based on, his activity, ongoing activity, I'm thinking that it's the early stages. And I was wondering...
well, first of all, let's back up a little bit. Do you know the name of these tumors? Are they benign? Are they malignant? Do you know anything about them?
I believe they are malignant.
Mm-hmm.
Based on, he said he had brain cancer.
Yeah. Okay, so he used the word cancer. Okay. Some brain cancers are due to certain mineral deficiencies. There's one mineral by the name of gallium, which is a big study in the UK, Great Britain, and they showed very clearly that there's one class of brain tumors. Okay, it's the tumors that involve the connective tissue of the brain. Okay, and these cancers of the brain are due to a gallium deficiency, and so of course one of the nice things about this program has lots of gallium in it. Also, it has lots of selenium in it. Also, there's lots of antioxidants in our program. How much does your brother weigh?
I would say probably 165, 170.
165, 170. Okay. Well, what I would do is get rid of all the bad stuff that contributed to the cause of brain cancer or any other cancer. No fried foods, no exceptions. You got to change all that. No fried foods, no exceptions. I don't care if you're stir frying with extra virgin olive oil and organic vegetables. No frying. Absolutely no processed meats with nitrates and nitrites. That means absolutely no deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam, all that kind of stuff's got to go. No oils. Yes, no olive oil, no coconut oil, no margarine, mayonnaise, salad dressings, cooking oils. If he eats canned fish, is fine. So they got to be packed in water, mustard, tomato sauce. And hang on. And after this message moment, Denise, I'll get your pen and paper because I'm going to give you a program for your brother after these messages. Okay, Doug, we're going right back to Wisconsin and Denise. Okay, none of the bad stuff. We've already gone through that. And what does this fellow weigh?
I'm thinking about 170, 175.
Okay, that's close enough. Closer to 200 than 100 is the important thing here. So what I'm having him do is take 2 healthy brain and heart packs per month. That'll be 3 selenium twice a day, but I'd also have him get an extra bottle of selenium so he could take 3 selenium 3 times a day, 1 set with each meal, 3 at breakfast, 3 at lunch, 3 at dinner. That'll require 2 healthy brain and heart packs per month and an extra bottle of selenium. And I want him to have 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, 3 of the EFAs at breakfast and dinner. All that will be accomplished by the 2 healthy brain and heart packs and the extra bottle of selenium. But because he's got brain cancer here, we want to add some specific stuff here. The secret sauce would be, in this case, I'd throw in Ocean's Gold. Now, most people think of Ocean's Gold as a thing for the thyroid. And then, of course, that's how it was originally formulated. And because there's things that do multiples of jobs, the Ocean's Gold is also good for anybody with cancer, and here's why. It contains the biggest supply of sea cucumber, and sea cucumber is legendary. Sea cucumber is legendary for helping people who have cancer of all types. And sea cucumber actually has biochemistry in it that supports the immune system, particularly for people with cancer. And, of course, your immune system is your best friend when you have cancer. Also, I'd have this fella get his, so I'd have him take 3 of the tablets, little green tablets, of the Ocean's Gold three times a day here. Because with brain cancer, you got to be really aggressive because brain cancer is aggressive. So I'd have him take 3 of the Ocean's Gold at breakfast, 3 at dinner time. That'll be 2 bottles a month. And then I want him to get his ORAC points, his antioxidant points, above 100,000 points per day. And there's 2 ways to do that. He could do it with 5 of the Cell Shield RTQ capsules twice a day, 5 Cell Shield RTQ capsules twice a day, or he could have 6 pieces of our triple treat chocolate, which I just had myself as a prevention, 2 for breakfast, 2 for lunch, 2 for dinner. It's going to give you, in either case, over 100,000 ORAC points per month. Okay, call me every couple of weeks. Anytime this guy goes in for an evaluation, give me updates all the time, and we'll walk you guys through this. Okay, Doug, we got time to start another one?
We sure do. Let's head to Georgia. And Mary, you're on with Dr. Wallach.
Hello, Mary. You're on the air.
Yes. Hello, Dr. Wallach. This is Mary Kay, and calling from Thomasville, Georgia. I heard you last night on the Benny Hinn show talking about helping Creflo Dollar's daughter with asthma.
Yes.
And
that was such a wonderful, wonderful experience. Yeah, here's a child, 11 years old. This was many years ago. This is 12 years ago. She's a beautiful young woman now. And, the doctors pulled the Pastor Dollar aside and said, look, she's in serious trouble here. She's not responding to medical treatment. Here's her prayer is going to help you a lot because we can't help her anymore. And so Andrew Young, he was part of the civil rights movement sort of constabulary. He was Martin Luther King Jr.'s sort of top general and kept the buses full during the protest. And he was the mayor of Atlanta. He was an ambassador to the United Nations, a great, great man. And he introduced me to Pastor Dollar. And we gave her the Healthy Start Pack and got her on a gluten-free diet. And praise God, 2 weeks she was cured. So hang on. We'll be back with you, Mary, after these messages. Okay, Doug, we're going right back to Georgia. And Mary, how can I help you again?
Yes. Like I was saying, I have symptoms of asthma, and I heard that you had helped Creflo Dollar's daughter be cured of that.
Okay. How long have you had asthma, Mary?
Probably about 5 years.
Okay. Now, do you have any children?
I do have one child, yes.
Okay. Does this child have any asthma or respiratory problems?
None.
Okay. Do they have any skin problems? Any eczema, dermatitis, psoriasis, or rosacea?
No.
Do they have any history of bowel problems, belly problems, things like irritable bowel syndrome, diverticulitis, colitis?
No, sir. He's a healthy young man.
Okay. No constipation, no diarrhea?
No, sir. No,
okay.
sir.
Well, I'd question him. I'd go ahead and ask him because he's at high risk of having the same problem you got. Okay, it's not genetically transmitted, but what we got here is a disease that's caused by a gluten intolerance. You can't absorb certain nutrients because the gluten intolerance affects the efficiency of absorption of your intestines. So what I would urge you to do is for yourself, get on a gluten-free diet. I would get your son on a gluten-free diet. If you have any siblings, if you have any brothers and sisters, do you have any brothers and sisters with health problems?
Yes, sir. Yes, sir.
Okay. Well, they have the same problem you do. It's not genetic, but Mama passed it on through cord blood or breast milk to each of you. And your sisters, if you have any sisters, they're going to pass this on to their children. Boys get it, but they don't have pregnancy, so they don't pass it on to their children because it's passed on through cord blood contamination and breast milk. But every one of your siblings, boys and girls, and all of your nieces and nephews from your girl siblings, from your mama's side, of course, need to be on a gluten-free diet. And in addition to the gluten-free diet, what do you weigh, Mary?
130.
130, okay. What I would do is have you get on one healthy brain and heart pack per month. One healthy brain and heart pack per month. And I'd have you take a extra bottle of selenium. So you have 3 selenium twice a day. That would allow you to have 1 ounce, half an ounce at breakfast, half an ounce at dinner of the OsteoFX Plus. That would allow you to have 1 scoop of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast. 3 of the EFA Pluses at breakfast, and 3 of the EFAs at dinner time. All right, and it wouldn't hurt to get another bottle of the EFA Pluses, so you could have 3 EFAs Pluses twice a day and 3 EFAs once a day, or 1 each 3 times a day. And then again, stay away from the bad stuff. No fried foods, no processed meats with nitrates and nitrites, no oils, and no gluten, no wheat, butter, or oats. Everybody in your household, man, mother-in-law, dog, cat, fish, bird, kids, grandkids, anybody who's living with you or visiting you has to be gluten-free. And nobody can be eating gluten in your house because of cross-contamination in the laundry, food preparation surfaces, food storage areas, the couch where everybody watches TV, the bed where everybody sleeps. Nobody in the household can be eating gluten, and that includes all your siblings, okay, and your son. Whether he lives with you or not, he's got to be gluten-free because he will show symptoms either now or later. And you might ask him. He may have a little problem that he's not sharing with you, so it'd be worth asking him. And then get back to me. Call me every couple of weeks. I want to know how you're doing because oftentimes just a change in diet, you're going to see some improvement. Then you throw in the Healthy Brain and Heart Pack. I mean, it's going to be like magic because you're going to support and promote healthy respiration, healthy pulmonary system. It is one of those things that just happens very, very quickly, very positively. Okay, Doug, we got time to start another one.
We certainly do. Let's head to Watsonville, California. And Michael, you're on with Dr. Wallach.
Hello, Doctor.
Well, Michael, you're on the air.
My wife has hypothyroid. They can't correct it. Her T3 is low. Her hair is thinning out. She gets hot and cold. She's gained weight, and she's depressed.
Okay, what does she weigh?
About 140.
How tall is she?
5'7".
Okay, well, she's still slim. Okay, 5'7", 140, she's slim. Okay, now, does she have any skin problems, any dry skin? She ever complain about dry skin or eczema?
I guess her skin's a little dry, yes.
Okay, because they usually tend to have dry skin with these problems. Does she ever complain about bowel problems, constipation where she needs laxatives all the time or fiber all the time?
Constipation once in a while.
Okay. Now, do you have any children?
One.
Okay, and this child have any health problems?
No.
Okay, how old is the child?
27. He's always tired, but he's always working.
Okay. All right. Well, yeah, your wife has a gluten intolerance. Okay? When you have dry skin, you have low thyroid, you got hair problems, hair falling out, gaining weight, all that is tied to a gluten intolerance because the efficiency of absorption of nutrients, particularly minerals, is way down. And so I'd get her on a gluten-free diet, no wheat, barley, rye, or oats, no fried foods, no processed meats with nitrates and nitrites, no oils. And then I would give her one healthy brain and heart pack per month, and I would get her 2 bottles a month of the Ocean's Gold, and I would give her because she had a little bit of constipation, I'd also give her a tablespoon, which is a half ounce, of the herbal rainforest at bedtime with a glass of water. So it'll be 1 quart of herbal rainforest is going to last her 2 months because she's only going to use a half ounce at bedtime with a glass of water. That's going to relieve her of the constipation. And the healthy brain and heart pack is going to give her what she needs for a 130-pound person, a 140-pound person. That'll be 3 selenium a day, 1 at breakfast, 1 at lunch, 1 at dinner, half ounce of the tablespoon of the OsteoFX Plus at breakfast and dinner, 1 scoop of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, the 3 EFA Pluses I'd have her take at breakfast, the 3 EFAs I'd have her take at dinner time, and then the 3 Ocean's Gold at breakfast and 3 at dinner time. That'll be 2 bottles a month of the Ocean's Gold. And the reason why even the medicine won't work and they can't get her thyroid under control, she's not even absorbing the medicine. Okay, I've had so many people, they'll get high blood pressure, they got diabetes, they got heart problems, and they're taking the medicine and they're not responding to the medicine. They say, well, if this is so bad, you're not even responding to the medicine. I get them on a gluten-free diet, get them on the nutrients, in like 5 days' time, they're off the heart transplant list. It's that dramatic when they get on a gluten-free diet. And so I urge you to do that for yourself, everybody in the household, including you and the dog and the cat and the bird and the fish, all your wife's siblings, all her brothers and sisters, your son, everybody involved has got to be gluten-free because of cross-contamination in the laundry, the food preparation surface, the bed, the couch watching TV, the dog, the cat, the bird, the fish. I mean, it's really, really that sensitive, okay? Call me every couple of weeks. Let me know how your wife's doing, Michael. All right, Doug, what we got going here?
It's break time.
That answers that one. Well, hang on, folks. We're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And, Doug, let's go to callers.
Let's head to the Virgin Islands. And Leandro, you're on with Dr. Wallach.
Hello, Leandro. You're on the air.
Yes, Doc. How are you?
Okay, sir. How can we help you?
I had operation on my spine in August last year.
For what?
I actually had a spine problem. Had 3 bulges in the vertebrae, and I had the prostate was pinching the nerves of the spine. And the doctor had to decide whether he's going to operate on the spine or the prostate. But he did operate on the prostate, and he gave me radiation for the prostate.
Okay.
And so I'm here now recuperating. And they say now I have bone cancer in the back.
Okay, so you have metastasis from the prostate into the vertebrae.
Uh-huh.
Okay, what do you weigh, sir?
Oh, right, I'm on 199, and I'm 5'9".
Okay. Do you have any other issues, diabetes or anything like that?
No, I don't have none of the diseases, none of them.
All right, very good. We got to go quickly here. Now, Shar, are you there?
I'm here.
Okay, here's a 199-pound guy, has a history of prostate cancer. He, has some metastases to his bones in his back. What would you do for this guy?
I would give him 2 healthy brain and heart packs, and I would also give him, he needs to take extra selenium, he needs to get on a gluten-free diet, and he should be taking the Cell Shield RTQ and the triple treat chocolate to get his ORIC points over 100,000.
Well, you get an A+. You hit the nail right on the head. She's exactly right, Leandro. Okay, get rid of all the bad stuff, the things that got you in trouble with cancer, particularly prostate cancer. No fried foods, no exceptions. Absolutely no processed meats with nitrites, no deli slices, sandwich meat, sausage, ham, bacon, and all the related stuff. No oils, no olive oil, no coconut oil, no margarine, mayonnaise, salad dressing, cooking oils. And as Shar says, you want to maximize the absorption of the good things, so you got to get off of gluten. No wheat, barley, rye, or oats. I mean, drop dead, no gluten, no wheat, barley, rye, and oats. I'd get a hold of that CD, Serial Killers, to find out all the hidden places. It's easy to give up bread, but that's not enough. You got to get rid of, the stuff that's hidden, too. And then for 199 pounds, Shar is exactly right, 2 healthy brain and heart packs and an extra bottle of selenium. So you could take 3 selenium at breakfast, 3 at lunch, 3 at dinner. I'd also have you take 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, 3 of the EFAs at breakfast and dinner. All that would be accomplished by the 2 healthy brain and heart packs plus the extra bottle of selenium. And Shar is exactly right. You want to get your ORIC points above 100,000, 5 Cell Shield RTQ twice a day, and or 6 of the triple treat chocolate a day, 2 at breakfast, 2 at lunch, 2 at dinner. And I would throw in, Shar, I would also throw in, because it's cancer, I would also throw in the Ocean's Gold for the sea cucumber. I'm really falling in love with the sea cucumber because we're getting such great feedback from people that have these problems with cancer, and so I would go ahead and take 9 of the Ocean's Gold a day, 3 at breakfast, 3 at lunch, 3 at dinner. It'll be 3 bottles a month, and you're going to get enough sea cucumber to support and promote your immune system here in this situation. We really want you to contact us every couple of weeks, anytime you go into the doctor. Keep us informed, and we'll kind of walk you through this. We'll make any adjustments necessary, and I just am so excited about the things that we can do for your immune system, which is where we want to go. We want to support and promote a active immune system so you get maximum benefit here. All right. Let's see here, Doug, how much time we got?
About 5 seconds.
Well, I'm going to go ahead and take it then. And just remind everybody, my new book is out, Epigenetics, The Death of the Genetic Theory of Disease Transmission. And you will find that if you avoid all the bad stuff and you give your genes and you give your DNA and your RNA all the nutrients, the 90 essential nutrients, you're going to maximize your genetic potential for health and longevity. Epigenetics, the book. Okay, well, thank you, Shar. Super job. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.